All right, let's make autonomic nervous system pharmacology easy. I mean, really easy. In the next few minutes, I'm going to give you the most essential, high-yield stuff you absolutely need to know, including those key drugs like Metoprolol and Albuterol. We're going to do it fast. Let's jump right in. Let's start with a situation that's about as high stakes as it gets. You have a patient. They have asthma, and their heart is absolutely racing. You reach for a beta blocker. Now here's the question. Did you just save their life, or did you just trigger a catastrophic, life-threatening attack? By the time we're done here, you will know the answer to that with 100% confidence.
But hey, before we can even touch that question, we first need to get a handle on the body's autopilot system. You know, the command center we're actually trying to mess with.
So the Autonomic Nervous System, the ANS for short, is basically your body's background software. It's the OS that's always running. I mean, the name autonomic literally tells you it's self-governing. It handles all the critical stuff you never ever have to think about. Your heart beating, your breathing, digestion. It's the ultimate autopilot. And this system has two main divisions that are basically opposites. The easiest way to think about it is like a car. You've got the sympathetic system, that's your gas pedal. It's the famous fight or flight response that revs everything up when you need to take action. And then you have the parasympathetic system, that's the brake pedal. It's your rest and digest mode that slows things down so you can recover and save energy. Okay, so that's the system. Now let's get to the fun part, the pharmacology. How do we actually use drugs to interact with all this? Well, it all comes down to hitting the right receptors, and we're going to start with the alphas. First up is alpha 1. And look, here is the only mnemonic you're ever going to need to remember its main job. Alpha 1, just think, all one blood vessels squeezes. Its main thing? Squeezing blood vessels. That's it. So how do we use this in medicine? Well, an alpha-1 agonist, a drug that turns the receptor on, is a squeezer. A perfect example is phenylephrine. You find it in decongestants because it squeezes the blood vessels in your nose. Now, an antagonist, or a blocker, does the opposite. It's a relaxer. Drugs like Tamsulosin or prazosin relax the smooth muscle for patients with prostate issues, or BPH, making it way easier to, go. Honestly, the best way to picture this is with a garden hose. Phenylephrine is like putting your thumb over the end of the hose. It squeezes down and cranks up the pressure. But what if the hose is already kinked and tight, like what happens with an enlarged prostate? Well, that's where Tamsulosin comes in. It's the relaxer. It unkinks the hose and just lets everything flow. Okay, let's move on to alpha 2. Now, this receptor is a little different, a bit of a curveball. The mnemonic to remember it is alpha 2, as in almost too much norepinephrine, time to hit the brake. It's basically a feedback switch that tells the system to calm down. The key drug to know here is Clonidine. It's an alpha 2 agonist, which means it activates this brake receptor. And by hitting this off switch up in the brain, it tells your body, hey, stop sending out all those fight or flight signals. And the result? Your blood pressure goes down. So this is the key takeaway, and it's a little weird, right? Clonidine is a paradox. You're giving an agonist a drug that turns on a receptor, but the overall effect is that it shuts down the whole sympathetic response. It's an agonist that acts like a blocker for the entire system. Okay, you with me? That covers the alpha system. Now let's switch gears to the other major players in this game, the beta receptors. And these guys mostly hang out in the heart and the lungs. And this one is, I kid you not, the easiest mnemonic in all of pharmacology. Beta 1, how many hearts do you have? You have one heart. And that's exactly where you're going to find most of your beta 1 receptors. Simple as that. So it makes sense that drugs targeting beta 1 are all about the heart. An agonist, like Dobutamine, we use that in heart failure to really kick a weak heart into gear and make it pump harder. On the flip side, an antagonist or a blocker, like Metoprolol, well, it does the opposite. These are selective for beta 1, and we use them to chill out an overworked heart, slowing it down and giving it a break. The logic here is just perfect. It's completely symmetrical. If the heart's failing, you give it a boost with Dobutamine. If the heart's working way too hard, you slow it down with Metoprolol. And that brings us to our last major receptor, beta 2. You see the pattern here, right? How many lungs do you have? You have 2 lungs, and that's primarily where you'll find your beta 2 receptors. A beta 2 agonist like Albuterol is an absolute lifesaver. It relaxes the muscles in the airways and opens them right up during an asthma attack. But And this is a huge but. This is the critical danger zone. A non-selective beta blocker like Propranolol doesn't just block beta-1 in the heart, it also blocks beta-2 in the lungs.
Let me put it this way. Albuterol is your best friend in an asthma attack. It specifically hits beta-2 to open up your two lungs. Propranolol, on the other hand, is a non-selective bully. It just hits everything in its path. And by blocking beta-2, it can actually cause the airways to squeeze shut, which, for someone with asthma, is incredibly dangerous.
Okay, we've got all the pieces. Let's put it all together and go back to that problem from the beginning. This is where all that theory meets cold, hard reality. So let's circle back to our patient. They have asthma. That's a beta-2 issue, right? Their airways are super sensitive. And they have tachycardia, a racing heart, which is a beta-1 issue. So the challenge is crystal clear. How do you treat the heart without messing with the lungs? So, what's the right call? Let's walk through it. Step 1. Analyze your drugs. Propranolol is the non-selective bully. Metoprolol is the selective drug that mainly targets beta-1. Step 2. Assess the risk. Giving the bully drug, Propranolol, is going to block those beta-2 receptors and could trigger a massive asthma attack. So, step 3 becomes the only safe choice. You give the selective drug, Metoprolol, to slow down the heart while leaving the lungs alone. And just like that, you made the life-saving clinical decision. Now, to make sure all this sticks, let's condense everything we just covered into one single, powerful summary slide. Okay, get your phone out because this is a slide to screenshot. It's got everything, the 4 key receptors, those easy mnemonics, and the classic drugs for each one. Alpha-1 squeezes the vessel, that's phenylephrine versus Tamsulosin. Alpha-2 is the brake, think Clonidine. Beta-1 is for your one heart, that's Dobutamine versus Metoprolol. And Beta-2 is for your two lungs, so you're using Albuterol. This is your go-to cheat sheet. You know, we've just figured out how to use these powerful drugs to manipulate the body's signals. But that brings up one last really important question. What happens when the wiring of the system itself is broken? That condition is called dysautonomia, and it's a sobering reminder that this autopilot system we've been talking about is one of the most fundamental and absolutely critical systems in the entire human body.